Now we will call the chairman, Professor Panagiotis Kandalakis, Professor of Surgery at the Medical School of Athens, and also Professor Michael Koutsileris, Professor of Experimental Physiology, Medical School of the National Kapodistrian University of Athens. We will hear after Austria and all the other countries for the influence of Hippocratic theory to Germany. And also, I think that Marinis Pirpiris is here, who will talk about the influence to the Australian medicine after Austria. So the word is to the chairman.
Thank you very much. It's a great pleasure to me to be in this, the first but very important Congress about Global Doctors Hippocratic Institute. I want to give my congratulations to everybody who has organized this meeting, and of course to my friend and the president, Mr. Dr. Patoulis. I want also to tell I'm very happy because we are in this table with my friend and Professor Koutsileris, who was for many years in Canada, and this was doctor abroad, but now he's returned at home. We start with Mr. Pirpiris Marinos, who is president of Greek Association in Australia. Mr. Pirpiris is one of the best doctors, and we give the floor to him to speak about the influence of Hippocrates in Australia.
Thank you. Thank you very much. Are you able to see the screen? You can see the screen?
Sure. Sure, go ahead.
Okay, great. Okay, thank you. So Australia is a very young country as compared to many of the European countries in terms of the European settlement. But the country is actually much older in terms of the Indigenous or the First Nations people that are here. And I'd like to acknowledge the traditional owners and custodian of the lands in Australia. When we look at our timeline, Australia was colonised by the Europeans in 1770, whereas Hippocrates was obviously, as we've heard throughout the whole day, in the classical period of Athenian democracy, and a very long time, almost 2,500 years from today. Now, it's interesting to think of Hippocrates and what Hippocrates would have thought about all this respect and reverence for him, because actually at the time, he was very much a pioneer. He was a forward thinker. He grew up very much at a time of conflict in Greece. He was challenged by the plagues that existed, and he had to overcome the theurgy at the time and elevate medicine to a discipline. So he was obviously a gentleman who enjoyed a challenge, believed in the principle, and was willing to follow through on scientific investigation, and came up with the concept of there being, rather than a punishment or a superstitious element to disease, the natural element or the biological element of disease. And that's been inspiring for doctors all the way along. Now, you know, sometimes when we look at the physician of Hippocrates, and my residents tell me this, they go, surely he could not have been sharp-eyed and balding and in a toga all the time. And I suspect there is a little bit of poetic license, but the poetic license and the artistry around was to try and capture the elements that the new generation are trying to aspire to, which is a very thoughtful and wise physician in these words, and that's been articulated many times, and also someone that had a lot of patience and for their patients, and a lot of understanding of their patients' ailments. A very knowledgeable doctor. So when Hippocrates was defining the new element, or setting the foundations of medicine as they are today, Australia was very much inhabited by a sophisticated but very different community that still exists, but didn't have access to many of the European teachings and principles. But the principles that came with the colonisation of Australia related to the practice of natural equilibrium. And from that, what came with it was a lot of the aspirational goals of physicians that came to Australia who wanted to do something better in a new country, in a new era. And one of the things that they would have been inspired by would be the hospitals. And in fact, the hospital, or the treatment centre of Hippocrates in Kos, which I visited, and I was taken back with the initial video by our president, Pirpiris, to the elements of how it may have been used many, many years ago with the swearing of the Hippocratic Oath. Australia has moved on from that, and throughout the Australian paradigm, we have 693 public and 657 private hospitals, inspired by bringing people together that are like-minded to treat patients to the best of their abilities. Teaching was a core element of the Hippocratic method, I would suggest, and it was important to Hippocrates that he teaches the next generation of teachers, and they not only respect him, but then they go on to teach the next element as well. And in fact, here in Australia, we've taken medical student teaching to the point where we have over 3,820 medical students a year that go through our various programs, graduating doctors that we hope are even more intelligent, understanding, empathetic than we are with the management of our patients. We took on governance, and this is the Pirpiris oxyrhynchus. And these elements are encaptured, and I listened to a very interesting talk earlier today from the United Kingdom, and actually the principles that Hippocrates espoused are mainly all contained with every code of conduct around the world. And Australia is not dissimilar to that. And that applies to many, many doctors throughout the environment. In fact, at the last census, it's a census year this year, we had over 43,500 general practitioners and 25,500 specialists that were signed up to these code of conduct in Australia. The oath is making a comeback. The medical students are looking for something different, something that's more inspirational, something that's aspirational for them. And they're going back to requesting and almost demanding an oath. And they very much love the romance of it all, but I think they also like thinking that they would like to be a better element of themselves. And the Hippocratic Oath, amongst various variations along the way, allow them to do that. And what the Hippocratic Oath has really allowed us also to do as a profession is it's given us the monopoly and the privileges that have been granted to us by government, probably starting many, many years ago with Hippocrates. And that allows us as professionals to practice our craft, to police our own ranks, and ensure that our doctors abide by a certain code of conduct. And the treatments of old, they've been refined. I'm an orthopedic surgeon, and Dr. Pirpiris is also an orthopedic surgeon, but we still sometimes, not very often, practice some of the methodology related to fractures. The principles are the same, but occasionally you'll have to use a Hippocratic method for the reduction of an irreducible shoulder. But this is the element, I think, that's inspiring people more today, the people of today. They've forgotten for a long period of time the concept, the holistic concept of wellness. And this is what's motivating people to find that inner sense of balance, to find who they are, and to treat themselves internally as well as externally, combining the physical, mental, emotional, spiritual, social, and environmental well-being. Because, you know, Hippocrates many, many years ago, and he observed there was obesity in Greece at the time. And he describes very well the obesity that existed between some of the Egyptian writers and some of the Greek writers many years ago. and came up that for good health, one must first ask oneself if he is ready to do away with the reasons for the illness, and only then is it possible to help him. And in fact, in 2008, the World Health Organization, with some Australian co-authors, defined that 80% of cases of heart disease, stroke, and type 2 diabetes could be prevented. And then the Australian Medical Association has initiated an Obesity Awareness Week. And it was a little bit too late, perhaps, because in 2017, perhaps the horse had already bolted, where 67% of the population were felt to be overweight or obese, and 38.9% of those aged between 18 to 24 are overweight or obese. And that is going to be a huge challenge that we'll face moving forward, particularly if that all leads to diabetes and heart disease and other problems with chronic health issues. The other thing he very much espoused was respect for teachers. And I think it was important for him to have a healthy respect for your mentors, for your teachers. And mentoring has been a huge Greek tradition that's gone over many millennia. That has actually been expanded even further now, because it's not only the respect for teachers, but a greater respect not only for the patients, which has been there all along, but also to our trainees. And we're extending a concept of respect to our trainees, a respect for their time, a respect for their opinion. And it's only in that way, as great communicators and great facilitators of the transition of knowledge to the next generation, that we can start grappling with some of the issues that the younger generation has today, which includes, you know, various concepts of what they feel is bullying or harassment. So Hippocrates in the 21st century would also have been a pioneer in diversity and inclusion. This would have been probably one of his key goals, because he was the pioneer in everything else. And medicine is now in Australia coming to grips with a concept of a diversity and inclusion, not only in general practice, because we have it all through the medical schools where 50% of our medical trainees are female, but also in our general practice and our specialist training programs. The other thing he was very strong about was an affordable health service. And in Australia, we have a nationalised affordable health service. And in 2019 to 2020, which is being audited at the moment, Australia is thought to be spending about $82 billion to provide people with healthcare so they don't have to go without. As disease was not a punishment, and we knew that about the bubonic plague, we found that even further with the pandemic we've had naturally. And, you know, in the great spirit of Hippocrates, the various countries banded together with a common ailment, which is the coronavirus pandemic. And the Australians are one of the first to successfully replicate the virus, because we've done a lot of work previously related to the influenza virus, and that was shared with the global community to try and come up with the vaccines that we have today. The Australians have also been a little introspective about various concepts in the past. You know, when it comes to mental health, traditionally it was seen as something that was extra physical, was metaphysical, was related to superstition and theurgy, and many of the treatments, including the treatments that were used probably in the 30s and the 20s, were a little primitive. And then it became more evident that, you know, there were natural biochemical causes for these various diseases. And Dr. Cade, John Cade, who was at the Royal Melbourne Hospital, the hospital I work in, he came up with the mood stabilizer of lithium, and he's decreased the need for ECD and lobotomy. Dr. Graham Clark, who worked at the children at the Ioneer Hospital in Victoria, came up with something that was very challenging, and he came up with the bionic ear by using biological basis and using the application of electronic signals to the brain and adapters, and he's helped over 200,000 deaf people. So, and now we're about to come up with, hopefully over the next couple of years, the first couple of prototypes of the bionic eyes through the University of Sydney. Now, this observational concept of vitamins and how it affects also applies to sleeping. We had a huge problem with sudden infant death syndrome, and Professor Terry Dwyer, on observing these children and sleeping and trying to analyse sleeping patterns, found that babies should sleep tucked up on their backs rather than on their tummies and not suffocate overnight. Helicobacter, also Ronan Warren and Barry Marshall here found that, you know, these ulcers that previously required some fairly difficult situations in terms of the Billroth surgeries were actually related to a microbe. Again, looking at the natural causes rather than just solutions that weren't working. And then they managed to eliminate a lot of peptic ulcer treatment with the triple therapy that we know today. We're very good at balancing individual liberties with the health of the community. And, you know, I think Australians did it quite well. We were shut down pretty quickly, and we managed to decrease the number of lethal cases. And you know, as Australians, we feel for all the people globally that have suffered with the coronavirus up to this point in time. Professor Fiona Wood had an idea initially with potato skin and then covering skin cells. And then she adapted that using that Hippocratic element of following through with natural new treatments. And she's developed the spray on skin. Electronic pacemakers came from an Australian that was thinking about how electrical activity will work. And then initially he resuscitated a stillborn child. And then this became the start of the development of the pacemaker technology. Ultrasound, you know, by adapting technologies and thinking about how they may work, is now widely used just through that Hippocratic method of following through on your ideals and investigating things that were previously thought too hard. And I think this is where it is at the moment. Like if Hippocrates was here today, you know, we've had our challenge with the various microorganisms, the bacteria, and now we're moving to the various viruses. And we're seeing viruses all the time. And this was Ian Fraser, who's managed to pioneer the papillomavirus to try and minimize these cancers who previously we could not explain. Herbs as medications were a big thing for Hippocrates himself, and you know, Alexander Fleming and Ernest Chain, but as well as Howard Florey, you know, adapted some of this. They followed through with this, and it was fortuitous at the start. It was a fungus on a bit of bread that inhibited some bacteria, but it saved hundreds and thousands of people from infections that we didn't know how to treat and perhaps were amputating. Spina bifida, you know, a bit of observational medicine in terms of what women were having during their pregnancy led to folate supplementation and the minimization of this disastrous condition, which was the myelomeningocele of the past. And as we become more innovating and we move forward, this is Gus Nossel. I met him many times at our university. He came up with an idea and then proved that one cell, one antibody, as we're applying this very much problem-solving in experimental methodology that Hippocrates would have been proud of. And this is Peter Doherty, a Nobel laureate. Actually, they're both Nobel laureates, as was Fleming. And Peter Doherty described the T-cell interaction and led us to a much stronger understanding of T-cell interactions and how virus-infected cells, which is very relevant in today's pandemics, can be affected and you can develop immunity. And all this, and this is why I'm inspired by this movement, has been inspirational. I've met Dr. Patoulis on a couple of occasions, and along with his great helpers and Dr. Pados and the whole Global Greek Doctors Institute, you know, they're inspired. They're bringing us together and allowing us to share ideas so that we have the best out of everyone, and down the track we can help solve some of the issues. So. And, you know, a few years ago, we had Konstantinos Pandos here, who's a fellow Australian, and I was blown away by his blastocyst technology that he studied in Melbourne, then he studied in Greece, came back and did some IVF training in Australia, and then came back to Greece and established a very exciting Genesis program, and very much like the Hippocratic concept where there was fellowship training in many of the different countries. So, you know, as we move forward, we're inspired in Australia by holistic practitioners, you know, treating patients completely. I'm concerned, like you are, that there is a little bit of a reductionist, you know, subspecialization concept. And it's movements like this through the Hippocratic Institute where we can bring people together and think about the patient as a whole. You know, Hippocrates would have been the consummate communicator. He would have been sympathetic, and he would have been a holistic treatment practitioner. So at the end of the day, patients would have been happy with the interaction as well as having had good care. So with that, I'd like to thank you for your time and share with you that Australia has been very influenced by the teachings and principles of Hippocratic method. Thank you very much.